Welcome to this session from SmartTots. My name is Suresh. I'm here at Lurie Children, so welcome to Chicago. Those of you who think that the weather is always this bad, no, actually it gets warmer. Shortly though. My colleague from up north here, Dr. Warner, will testify that it's actually much nicer here. This session is being live streamed, which means we have people from all over the globe participating in this. So we do have some series of questions that people can send from anywhere. We're very excited to put this panel together. So every year we try to bring you the latest things that is happening in SmartTots. So just to as a disclosure, I am on the board of trustees of the IARS, and I do serve as the co-chair of the SmartTots steering committee. SmartTots was formed as a public-private partnership between, between the FDA and the IARS in 2010, and we have been diligently working together to ensure the best outcomes we can for children. So goal here was to create a guide for scientific direction, raise funds for research studies, and disseminate the research findings nationally and internationally. Based on this, the group got together. This is with the FDA, and several of you who are here who have actually contributed immensely to the outcome of SmartTots. We came up with a consensus statement in October 2015, which has been updated. And we had a revision. Again, this was endorsed by the American College of Surgeons, AAP, ASA, the Society for Pediatric Anesthesia. There was an advisory that was sent out from the FDA on December 14th, 2016, which talked about the safety of exposure to anesthesia. And this was a US FDA warning. And again, I want to preface this by saying some of us had participated in the scientific advisory board, and this was based on presentation that was given to the FDA advisory board 2 years prior to this statement. So our learner objectives for this session today is to review the basic neural circuit mechanism of anesthetic drugs and how they relate to electroencephalogram. We're going to examine age-dependent changes in anesthetic-induced EEG in children and how this activity relates to brain development, and examine how anesthesia-induced brain activity differs in infants and children. We'll also discuss the basic neurobiology of critical period of plasticity in early childhood, and how this relates to anesthetic mechanisms. We'll also describe the major findings of the Mayo Anesthesia Safety in Kids MASK. We need an acronym, and it quite masks the study, and compare how the MASK study results relate to prior preclinical as well as clinical research study. So this is going to be a transition from one speaker to the other. So what I would do in order for you to have a continuous experience, I would rather not interrupt, but I'm going to introduce all three speakers at this present time, and we'll have each one of the speaker follow each other. So the first speaker will be Patrick Podon, who is a Nathaniel M. Sims Endowed Scholar in Anesthesia Innovation and Biomedical Engineering. He's an Associate Professor of Anesthesia at the Department of Anesthesia, Critical Care Medicine, and Pain Medicine at Harvard Medical School at Boston. Patrick will talk to us about the developing brain under anesthesia, oscillations, neural circuits, and critical period plasticity. This will be followed by my partner in crime, Beverly Orser, who's a board member and also a member of the SmartTots steering committee, she's a professor of anesthesia and physiology, and she's the chair of the anesthesia department at the University of Toronto Faculty of Medicine. She's director of research for the Department of Anesthesia at Sunnybrook Health Sciences Center in Toronto. And she will talk about preclinical data. Is this always reproducible? This will be followed by the mask study. What does it tell us? And another partner in crime, David Warner, who I have the pleasure of working with on the American Board of Anesthesia. He's a professor of anesthesiology and consultant in the Department of Anesthesiology and Perioperative Medicine in the Mayo Clinic of Medicine and Sciences in Rochester, Minnesota. And this study was just published recently. I'm very excited. What we have tried to do with this SmartTots panel is try to go from basic science to preclinical studies to clinical sciences and try to mesh all three of them together. So again, this is being live streamed. We have people from all over the world participating in this. The one thing that I want to also acknowledge is Lena Sant. Lena, would you please stand up? Lena is now part of the SmartTots, and she is what I would call, she's going to develop the program for SmartTots. So thank you very much, Lena, for your participation with SmartTots. And she has a vision that is going to be very helpful for all of us.